Not bad.
Thought I'd treat myself.
You deserve it.
You think?
No.
Me?
What's that?
Well, A&E patients never bring the crutches back. Christine's been on our back about the budget, so?
So?
Crutches amnesty. Bring the old ones back, £1 a pair, no questions asked.
Great idea.
You got a better one? Would you hang on to those for me, mate?
A well-perfused patient with SVT. What drug treatment,
Adenosine.
Yeah, of course. Oh, no.
Stop panicking, you'll be fine.
I know, but I can't remember bringing up with Edward Scissorhands.
Yeah, but you look great and you know more than the instructors put together.
Yeah, well, fingers crossed it. No, maybe not.
Hello. What's going on with her?
Advanced life support exam.
She's talking about nothing. It's a piece of piss. Oh, you look well. New fella?
No. New car.
Ah, flash one.
Robert's in yet?
In the office, Chris.
Ah, my ass. She's got a new fella.
Do you reckon?
I've got built-in radar. Industry standard.
So, Mike and Miss Smartass, living together or living together?
Living together.
Thanks, Stu.
Hello. Dr. Fletcher, the, last night, it wasn't that good?
Well,
No, do help me improve. I need the counselling. Lunch?
maybe.
Resource, Chris.
Oh, right.
Robert. Yeah. Building site accident, 2 casualties. 4 minutes.
One res for this?
Why not? He's in a good mood, isn't he?
I didn't notice.
Blood chest trauma, distended abdomen, multiple soft tissue injuries, BP 120 over 90, pulse 90, GCS of 5.
Okay, intubated at the scene, 2 litres of heart
On my history and open female pulse 90, BP 140 over 90. Ronnie, can you hear me? You're going to be okay? 2, 3. Terry, he just keeled over on him. I'm sorry. Come on, mate, out of the way now, we'll look after him. He's going to be all right, mate.
It's going to be fine.
Reduced air entry on the left.
Example, our job is in the way.
Everything is soft.
In a minute. They just have you over here a minute.
Oh, God. Keep some pressure on that, will you?
No, Chris, I'll look after that, thanks.
Oh, yeah. All right, 2-0 neg, 6 cross-matched. Get a general surgeon down here. Chris, I got a bleeder.
Okay.
Chris, I need you now with a clamp, please.
Okay.
Good.
Let's get a tube.
Bleed.
He's breathing fine, can't that wait?
GCS is 7.
Yeah, and Raz is on the way down.
Accommodate and sucks, please.
Thank you. You don't have to do this, Stu.
Accommodate.
General surgeon.
Sucks.
Stu.
Size 8.
I can't see the cords. Starts to dropping, Stu.
What's going on?
Stand over there, mate. Over there, please. Heart rate's fallen. 50. 30.
Yeah. Sit. He's arrested, Stu.
What's going on?
No.
Christ, you stuck it down the esophagus. All right, we've got a grade 3 difficult intubation here. It's a recessive jaw. Bougie, please, Terry. Thank you. How are we doing?
Yeah, I've got a pulse. Sats on 96%.
Take the bag, please, Terry. How long was he without oxygen?
Too long.
Good. Well done. You okay?
Yeah.
Okay, let's send some gases off and get him around for a head CT.
Is he going to be all right?
I hope so. Do you know his family?
Yeah, his wife, Babs.
We need to contact her.
God, what a mess.
Yeah, I've got an open femur here, but otherwise he's stable.
About you, Robert?
a bit of a mess. I plugged up the holes
You did?
with the help of my partner.
I screwed up, Chris. Patient had a recessive jaw. I couldn't get the tube in.
You tubed him. You were on your own. You should have waited for help.
Less than 8 intubate. It's a rule of thumb. You made a judgment call.
Judged it wrong.
How long without oxygen?
About a minute. Maybe 2.
I see.
Oh, yeah? Excuse me?
Yes, sorry.
Anna, I'm afraid your wrist is fractured, and I'm going to need to plaster it.
Oh, sorry.
That's okay. It's no more DIY for you, that's all.
Oh, good. He's useless at it.
Oh, I feel like a right lemon. A ladder went from under me.
I'm more of a GSI than DIY man myself. Get someone in.
Just lost my balance, that's all.
Were you dizzy?
Yeah, bit.
You never said.
Oh,
First time you've had a spell?
I think so.
Okay. I'm just going to run a quick neuro exam.
Yeah, but it's the wrist that hurts.
Okay.
Teresa Simpson, probable ankle fracture. Jumped off a wall.
Is it going to be okay?
Teresa's a dancer, student.
Right, okay, try and relax, Teresa. I know it's difficult. And we'll have a look. Right, on my 3. 1, 2, 3.
I heard about what happened with the refugees. Nice one.
Thanks.
Oh, you should get a medal or something. Well, the press are coming in today. Going to take some photos and run a story. I'll look out for it. See you.
You didn't bang your head, did you, Teresa?
No.
I'm not having my photo taken.
Why not?
Can we get some Internox? Gonna give you something for the pain, Teresa, all right?
Thanks.
It's only a local paper, Andrew.
Now, can you feel that? He needs to get his x-rayed.
Yep.
What happened?
Messing about and fell.
Can we call you folks?
They're on holiday. Cyprus. Numbers in my bag.
Right, we'll contact them for you.
I need my ankle. Please.
Look, don't worry. It'll be fine. Fractures like this, 10 a penny.
Yeah. Sam will... she'll look after you.
So, you're a dancer, eh? Have to show me a few tricks when you get better.
Hey, there she is.
Well, how did it go?
Very well. Pass.
Piece of piss, see? Drinks on you tonight, then, kid?
I think so. Excuse me, Master. Dad? Hello, love.
How are the exams?
What are you doing here?
I bet you blew them away.
Is he all right?
Mike, the CT scan's ready.
Thanks.
What's going on?
Oh, he fell off a ladder. I bought a new light fitting and he was...
bumped his head.
No, his wrist. He's about as clumsy as you are.
Okay, let's go.
We didn't want to worry you, what with your exam and all that.
I'll be along in a moment.
They
Mike,
never said they were your parents, or I would have contacted you.
why the CT scan?
It may be nothing, just a few reduced reflexes. Has he had dizzy spells before? Judy?
Dad had a kidney out 5 years ago, next month. Renal cancer.
He never said.
No, well, he wouldn't.
Look, it may be nothing, okay? So there's no point in worrying just yet.
Okay.
It's blurred, difficult to see.
Too much artifact. We'll do another when he gets to ICU.
No apparent sign of fracture, though. No hemorrhage.
So far, so good.
Hypoxia?
It's when a brain's starved of oxygen, it doesn't show up on the scan immediately.
Well, thanks for telling us, Jack.
Well, it has to be said.
How did the femoral nail go?
Piece of cake, except he's still unconscious. I'm wondering why Stuart was unsupervised.
Well, I needed Christine with me. Stuart's done loads of intubations. This just happened to be an awkward one.
Your SHO fails to spot a recessive jaw. Should have waited for Raz. He didn't. And he cuts the patient's oxygen supply.
This is my fault. I should have stayed with Stuart.
Junior doctors shouldn't be encouraged to act alone.
You're questioning the way I run my department.
Well, someone has to take responsibility.
I'm up for that.
Here's an idea. Why don't we wait and see? It could be nothing. The patient could make a full recovery.
Okay.
Your department. Suddenly, it's your department again.
I called you away from Stuart. My decision. Simple as that.
Would you give these to?
Yeah, mate, I'll take them. Thank you.
Give me a quid.
Hang on. Here you go.
Nice one.
Okay.
Stuart,
Any news on Ronnie?
no obvious sign of brain injury on the scan,
Right.
but he's still unconscious. Now, don't go putting 2 and 2 together and making 5.
Of course not.
Hey, it's working! Well done, Terry. You're a brick.
Thank you, boss.
She say brick.
Excuse me, can you help me? My husband was brought in this morning, Ronnie Davison.
Mrs. Davidson, just come with me and I'll page the doctor who dealt with him.
Mrs. Davidson, I'm Dr. Phil and I treated your husband.
Stuart, this is Robert's call.
Oh, what's happening? Is he okay?
If you step this way, I'll explain fully. Please, Miss Davison, take a seat.
It's bad, isn't it? Is he...
Please. Your husband had a bang to the head and a fractured leg. We fixed the leg. He's presently stable and in no pain.
Can I see him?
Yeah, of course. Ronnie's in intensive care. As I said, he's stable, but he's still unconscious.
Is that bad?
There's no sign of brain damage. No fracture of the skull or apparent hemorrhage.
Please, just tell me he's going to be okay.
We're trying to find out why Ronnie's still asleep. There are a number of reasons it could be.
But you said there was no brain damage. I don't understand.
Ronnie hit his head when the crane fell. He was unconscious when he came in. I took the decision to intubate, which means I put a tube in his throat to make sure the airway was clear and he was getting enough oxygen. There was a problem, and I lost some time.
What are you saying?
There were complications.
You made him worse.
Possibly, yes.
Hear the wife's in. How's she taking it?
Putting a brave face on. Chris, you should know. I told her I screwed up.
What?
It was the right thing to do.
This isn't some kind of moral crusade.
I couldn't lie to her.
We still don't know why Ron's not woken up.
She deserved to know the facts.
Telling her might have eased your conscience, but what good does it do her?
or the department. Right, boss?
I've been getting all the gossip on you. Only child, very spoiled.
Oh, we didn't say a word, promise.
I'll leave you to it then. Thanks,
Bye.
Kath.
Bye-bye.
So, balancing on ladders. What were you thinking?
Just a little job.
You're lucky you didn't electrocute yourself. You know what you're like, you can't even change a plug.
Mr. Williams?
Do I have to do this?
Might as well get it over and done with.
Can't I just go home?
You're scaring yourself about nothing, Dad.
I bet that's what you say to all our patients.
Andrew, I've got Teresa's x-ray back. It looks pretty gruesome.
Okay, let's have a look. Oh, Jack.
Yeah.
16-year-old girl fell 8 to 10 feet under concrete.
Oh. Well, it's a severely comminuted fracture of the talus involving articular surfaces.
What?
It's buggered.
Can you operate?
No, won't do any good. It'll heal itself over time.
Well, long-term outcome.
Stiffness, severe inflexibility.
Oh, great. She's a dancer.
Not anymore.
Do you know he's refusing to have his photo in the paper?
Is that right? That's a pity.
It's so quiet in here. When he's awake, he's always on about something. I pushed him out of the house this morning. I just wanted a bit of peace.
Do you want me to call somebody for you?
My brother, Etty.
Yeah, I can do that. Hi, Jack. This is Mr. Turner. He operated on Ronnie's leg.
Mrs. Davidson.
So if you have any questions.
The young one, I can't remember his name. He told me something about Ronnie not getting enough oxygen. You can fix that, right?
Thank you. Well, it was extremely tricky. What happened?
I think we're going to know more, Mrs. Davidson, after a second scan.
Yeah, Ronnie has what we would
Robert,
call...
two things. If you can give me a moment. Excuse us.
Excuse me. What am I? A threat to national security?
He told her.
Who's going to come out sooner or later?
This is an A&E department, not a bloody confessional.
Well, what do you want him to do, lie?
Well, if he said nothing in the first place, he wouldn't have to, would he?
Teresa? Hiya. I just wanted to say that your mum and dad will be here late tonight.
Thanks.
There you go. How are you feeling?
A bit groggy. Have me x-rays come back?
I'll just go and check.
Well, exactly.
I'm really sorry.
Can I tell him?
Sure.
Just...
Dad?
Shall we go to the relatives' room?
Why? What is it?
Oh, come on.
When Dr. Gregson examined you earlier, he was worried about some of your reflex responses. That's why he asked for the CT scan. Dad. They found a lesion on the scan. And it's not from the fall. I'm sorry.
It's a malignant tumour. Secondary cancer, probably spread from your kidney.
Where are they taking him?
For a second scan. It should help us find out more.
Can I go with him?
Yeah, of course. Okay. Good luck.
Been unburdening yourself again?
It was her right to know.
She, going to want to take this further, do you think?
She doesn't fully understand what's happened.
Oh, that's encouraging, at least.
You always this cynical?
Practical, Stuart. Practical.
Excuse me. I'm looking for Ronnie Davidson. I'm his brother-in-law.
Right, this way, please.
Well, you going to tell her now or what?
No. You are.
Most people would see a 5-year remission from cancer as an all clear. But I'm afraid secondary tumours can occur.
What are the options?
An operation.
What about the risks?
There's always a risk with major surgery of this sort.
But the success rate's improving. It's getting better all the time.
Dad, have you got any questions?
Yeah. What if we leave it be? That's hard to say.
How long would I have?
If we do nothing. You could go on for a long time. Or as little as a few months. I'm afraid you'll have to excuse me.
Why don't you take some time together? I'll speak to you later, Judy.
Right back where I was 5 years ago.
We fought it then. We can fight it now.
What if something goes wrong? It's my brain they're messing about with.
Nothing will go wrong. Tell him.
I'm 55 years old. I have seen a lot of wear and tear. My chances cannot be that good.
Please. You've got to just give it a try.
You know all the ins and outs. What do you think?
Dad,
But I'm not a patient, am I?
what do you want to do then?
Go home, watch the telly.
You've been given the opportunity of a second chance. Don't throw it away.
I've had that already.
If we hadn't come in here today, you might never have known.
Maybe that would have been better.
Don't bail out on us, not now.
Doctor said it could be ages.
I'm not sure that I can live with that hanging over my head.
If it was you, would you do it?
Dad, I can't.
Tell me what you think. Really?
I'd go for it.
I haven't told Teresa yet.
Why not?
Well, partly because I bottled it and partly because I think that it's your job.
Everybody has to break bad news.
Oh, come on, you've had years of experience dealing with patients.
Go and get some experience.
What's the matter with you? Is this to do with last week? The girl that died?
Just don't want to be a doctor anymore.
You've got a 16-year-old in there. Her career's over before it's even begun.
What if I told you I didn't care?
I tell you to get off your ass and get in there.
Nothing gets to you, does it?
She's a kid, Andrew. Stop feeling sorry for yourself.
Well, this had better be good, because Ronnie's brother-in-law's an aggressive little bugger.
Loss of grey-white differentiation.
Shit.
Could be nothing.
But it could be a sign of hypoxic brain damage.
What do we tell his family?
Well, I could persuade them towards a complaint rather than a lawsuit, but it's...
No, leave it to me. Stuart was acting under my supervision. Stuart's mistakes are my mistakes.
I'm sorry.
Well, that's very generous of you, Robert, but it's the hospital that pays.
And Stuart?
If they win compensation, we could face an internal inquiry, reorganisation, and all that means, and Stuart could well be finished.
If it comes to that.
Where are you going?
Tell the family.
He's so bloody minded. Always has to play the hero.
Well, there you go.
I'll go after him.
Thought you would.
What's with Aaron, Mike?
He's just flatmate.
Ah, yeah. Heard that before.
I'm jealous.
Of what? Hey, shouldn't you be out there? Don't you want to hit the headlines?
No, thanks.
Well, you saved the day, didn't you?
Did I?
Ah. Butchers. Thank you. You go.
Sit down, sit down. I'll get your chair, Mr. Jones.
How are you bearing up?
All right, in the circumstances.
Is there anything I can do?
Well, you can tell us what happened this morning, for starters.
We had some difficulties.
Difficulties? Is that what you call it when your stuff bugger up?
Eddie, don't.
I'm sorry, Barbara. Let me deal with this. We may well have lost Ronnie, and I just want to hear what they've got to say for themselves.
Your husband has what's known as a recessive jaw. This makes access to his windpipe very difficult. The situation this morning was critical, and we didn't have much time.
And your doctor, feeling, is it, made Ronnie worse?
He tried to intubate, yes, but as I explained, conditions were very difficult.
For Christ's sake, he's a doctor. He should know what he's doing.
Ronnie still could be fine.
Don't bullshit me. Feeling screwed up, and now you're trying to sweep it under the carpet.
No, we don't work like that.
It's just too early to tell.
Come on, Barbara. How about enough of this crap? You'll be hearing from my lawyer.
Mr. Johnston, you're perfectly within your rights to initiate a claim for negligence, but just remember, legal action can swing both ways.
I've got you and your hospital against the wall, and you know it.
It seems to me that you care more about what you can make of this than what actually happened this morning. My staff give 100%, working long hours for crap money to look after people like you.
Robert?
Now pursue this by all means, but if you have a Stuart feeling, I'll stick a court order on you faster than you can say ambulance chaser. What?
You shouldn't have done that.
Well, somebody needed to say it to him.
And why does the somebody always have to be you?
Yeah, as far as I know, that's all they found. Oh, hi. You got enough, Ed?
Yes, that's fine. Thank you very much.
I'm still. How did Robert get on?
The brother-in-law's taking legal action. Robert lost it with him, which didn't help.
Does that surprise me?
This isn't funny. I tried to stop him, but I might as well not have been there.
Well, maybe he's just trying to protect you, maybe.
I don't need his protection, your protection, or anybody else's. Remember that.
Is this our first argument?
I don't know, is it?
Looks like it.
Fine.
Yeah. That's okay. We get to make up in a sexual frenzy.
You've got a one-track mind.
Yep.
How you doing? I'm okay. You seen Mike? I'll get him for you.
Judy?
No tea and sympathy, please.
Okay. You take it easy, eh?
Yeah.
Judy?
Mike, Dad's decided he wants to go for surgery.
Well, that's great. That's great. Listen, the neurosurgeon's got a similar op on Thursday. Robert thinks if there's time, he could do it back-to-back.
Okay.
Yeah?
Thanks, Mike.
Great.
Ah. Sam thought I'd find you here.
Well, she's a little telltale.
Well, no. She was worried about you, actually.
There's no need to be. Actually, Jack, this is my break.
Well, I just wondered why you didn't want to do any of the press stuff.
Just didn't feel like it.
Could have helped the hospital.
Oh, would it? Well, I'm so sorry. What do they want, anyway? Some sensationalist, sentimental piece of crap?
Well, you were very impressive. We thought so.
She died anyway. Might have died.
Yeah, but you helped her through it, and you made it more bearable for her, and...
I lost her, Jack.
No, you didn't lose her. She didn't stand a chance, you know that.
Oh, I don't know. Sometimes you meet someone and something happens, I don't know what. And then they're gone. Just like that.
Yeah, well, lots of people spend years in pointless, hopeless relationships. At least whatever you had with her, however short, it meant something, didn't it?
Do you believe that?
Yes, I do. And you should hang on to it. Otherwise, what's the point?
I'm so sorry, Babs.
I thought I saw him move.
Joe's agreed to make a statement to the lawyers. He's our star witness.
But nothing's changed on the monitors. Do you think I should call a nurse?
I want Phelan to come clean. With Joe there, he can't wriggle out of it. Come on, love, stay with it for Ronnie.
That's what I'm doing.
You've got to think of the future. No money coming in. They owe us.
Ronnie's not gone yet.
You know what I mean. Are you coming with us?
I'm staying here.
What's the matter with you?
Leave her, eh?
Barbara.
Dr. Phelan?
Yes?
You know about the litigious brother-in-law?
Yes.
If he's still around, I should avoid him.
I'm not going to run away from him, if that's what you mean.
Principles are expensive, Stuart.
I nearly killed a patient.
No, he nearly died. There's a bit of a difference. And Christine says you're an excellent SHO.
Does she?
So if you keep quiet about it, the flak will go over your head.
Who is it going to hit?
If you make detailed notes of what happened today...
No, I asked who is it going to hit?
Well, you were unsupervised. Not your fault.
Come on.
If it goes to court, whatever happens, it's the hospital that carries the can. Ah.
Steve Moore.
That's right, yeah. Can I help you?
I'm here about my girlfriend, the one that died. I've got some questions.
Right, I'll get a note. Her surname was...
Pearson.
Pearson.
It says here, she suffered an event called pulmonary embolism.
That's right.
A large blood clot formed in her vein and travelled up into the lungs. But it still doesn't tell me why.
Well, that's the medical reason.
But why?
Steve, you're going to have to accept that we did everything we could for her. Modern medicine is a wonderful thing, but it cannot prevent the inevitable.
No. Of course. See? Thank everyone for what they did personally. Especially Dr. Fletcher.
Well, that's very kind of you. Much appreciated. She's rather busy at the moment, and indeed, I've got to get a few things done here.
Of course.
Is there anybody you can talk to about this?
Maybe I should.
It might help you understand the way you're feeling.
Thanks again. Just one more thing. What's her name?
Beg your pardon?
Her first name. My girlfriend, you call her Miss Pearson. What's her first name?
You don't know? No, please.
Oh, bullshit! Just like all the rest! All the rest!
I just heard.
There's nothing. Hey. It's just about Stuart getting his revenge.
Can I have a go before there's a queue? Look at you.
What happened to Steve Moore?
The police took him away, probably to be sectioned again.
Shit.
It's not your fault.
No, somebody dies on my operating table. I can't remember the name. It's not.
It's still not your fault.
Is it standard procedure down here?
Oh, yes.
Do you find it works?
Most of the time.
How you doing?
Robert, thanks for leaping in.
What was I going to do? Let you get beaten up?
Well,
Eddie Johnston's got a witness from this morning. Site foreman claims he saw the whole thing.
yeah, well, that hurts.
Good news. The neurosurgeon can fit you in this week.
Well, is it that urgent?
Robert pulled a few strings.
Seems a bit rushed.
Well, better sooner rather than later. Definitely. Dad, it'll be all right. I promise. In 6 months' time, we will be through all this.
Yeah. Gotta look ahead, eh? I'm gonna be okay.
How's it going?
Okay. Do I need an operation?
That won't be necessary.
I've got this NDA shirt. Agents are coming and everything. I couldn't bear it if I missed it.
Teresa. You've sustained a serious injury. A severe fracture to one of the bones in your ankle.
But you said that.
Now, just because we're not going to operate doesn't mean that is good news.
When am I going to be able to dance again?
There'll be some stiffening. Loss of flexibility will give you physio.
When?
It's not a question of when. It's a question of if.
Oh my God.
I'm sorry. I really am.
Hi, Stu. How you doing? You well?
Yeah, you?
Not too bad, not too bad. How's your hangover?
Sorry, don't get him.
Sam, everyone gets hangovers.
Not me.
Is that a challenge?
Seen Terry? Yeah, he's just there. Hi, Terry.
Ah.
Yours a fiver.
How many there, 10?
Groceries.
Okay. You go. Thank you.
Thanks.
Terry? What's going on?
Could ask you the same thing, mate.
Terry, I've just had physio on the phone. Seems that there's a bunch of patients out there wondering who's nabbed their only means of support.
Oi, you two! Come here!
Whoa, hold it right there.
Let's stay. Oi.
Give me the money.
Do you want?
I've called security. You've got about a minute.
Come on, give it on.
All of it.
Cow.
Thank you. Right, now get lost. I don't want to see you here again. Thanks, Mike.
Oh, that's great. Why didn't you grab hold of them, Sam?
And why don't you get off my back, Terry? All present and correct then?
Suppose I'll have to buy you a drink tonight now.
Oh, trying to get into my knickers again?
No, I am not.
Good. Anyway, I'm going out with Mike tonight. Reckons it can drink me under the table.
Mike, he's done in after 3 pints, son.
Go on now. Come along if you like. Witness his downfall.
Sam. Thanks.
Any change?
No.
I'm sorry about earlier. I was on duty. I'm here now. Is there anything you want to ask me?
No, thank you.
That's my mobile number.
I'll have that. It's all right for some, eh? You can just walk away. What is it tonight? Out dancing, maybe? Or the cinema?
I'm sorry for Ronnie and what you've both been through.
So you admit you made him like this?
I'm a doctor. I tried to help people. Today I made a mistake.
You heard that?
Be quiet, Eddie.
By the time we've finished with you, you won't be a doctor anymore. Do you understand?
Shut up, for God's sake. Ronnie's lying here and you don't give a shit.
What are you on about?
At least this doctor cares.
This doctor's the reason he's here.
No, Eddie, you are. Always banging on about the money we owe you. He wouldn't have been on that site if he hadn't been so desperate to pay you back.
Now, that's crap.
I'd better go.
No, stay. Please. You can go.
Barbara.
You never liked Ronnie, did you? Never thought he was good enough for me.
That's not true.
Well, you've got what you want now, haven't you? Him lying there half dead, and you a return on your bloody money.
Yeah, whoa. When the business went bankrupt, when Ronnie lost it, I was there for you.
Go away.
You okay?
I should have said that years ago. Eddie's always been like that. Control freak. Ronnie kept telling me to stand up to him. Do you have brothers and sisters?
Yeah. I'll get an anaesthetist. Robert.
Hiya.
They've extubated Ronnie. He's awake and talking. He's going to be okay.
Oh, yes.
Now that is good news.
You should see the brother-in-law. He's gutted.
What did you hear?
I was there when it happened.
You went back?
Yeah. I suppose I did. Sorry.
Good for you.
Well, I think they're very lucky.
Stuart and Robert?
Yep.
You're disappointed.
No, I just like the battle, that's all.
And you've got the scars to prove it.
Is this it?
Mm-hmm.
Well, that's very nice.
Pity you've gone and lost your licence, otherwise you could have taken it for a spin.
No, I'm a very good passenger.
Looking for a lift?
No, I'll take the bus. I'm happy to take the bus.
Here. Sam says she didn't get hangovers.
Oh, yeah, right. Lucky her.
So we've lined up a lethal combination of cocktails at the pub. You gonna come?
No, I think I'll pass, mate. I'm knackered.
What a party pooper.
Hey. Set one up. I'll see you there.